Good day, everyone. I'm Dr. Francesca C. Alvarado, a board-certified dermatologist from the Philippine Dermatological Society, and I'm this month's Dr. Skin. So today, I'm here to talk about one of the most pressing health issues worldwide, which is about the novel coronavirus or coronavirus disease 2019. Just to clarify, the name of the disease is Coronavirus Disease 2019 or COVID-19, while the name of the virus is SARS-CoV-2 or 2019 Novel Coronavirus. This virus belongs to a family of envelope coronavirus and has been postulated to originate from a zoonotic infection, meaning being transmitted from an animal to a human. But it is now primarily accepted that the transmission is from person to person. Viral particles enter into the lungs via droplets. For example, someone sneezes or coughs, or if somebody exhales viral particles and you inhale it over short distances of about 3 feet. Other possible routes are through contact by body surface to body surface or through contact with contaminated objects like unclean hands. Another theoretical or postulated mode of transmission is through the enteric route, which means being shed through the feces or fecal material and then going to someone else's mouth or digestive tract. The incubation period of this viral infection is usually 4 to 14 days but may last up to 24 days. The incubation period means the time from exposure to the onset of symptoms. So the symptoms may be mild in young and healthy individuals, but more severe in those with other comorbidities, such as diabetes, COPD, and heart disease. It may also be more severe in the elderly. As for the clinical presentation, cough is the most common symptom, and it's usually dry cough. Next is fever. Other symptoms are shortness of breath, sore throat, diarrhea, and body pain or tiredness or weakness. However, there are diseases that present with overlapping or similar symptoms, such as the seasonal flu, common cold, and allergies. So how does COVID-19 differ from other diseases with similar symptoms? Almost all these diseases present with dry cough. COVID-19 primarily affects the lungs, and its common symptoms include fever, dry cough, shortness of breath, in a patient with a positive travel history or is residing from or in a place with local transmission. Sometimes, patients may experience headaches, body pains, sore throat, fatigue, and rarely diarrhea and runny nose. Sneezing is not expected. Symptoms last from 1 to more than 3 weeks. The closest disease with other similar symptoms is the seasonal flu, which affects the whole body. Common symptoms include fever, dry cough, headaches, body weakness and body pain, and sore throat. Sometimes patients may experience runny nose, headaches, while diarrhea is a symptom that is found in children with flu. What's not expected is shortness of breath and sneezing. For the seasonal flu, symptoms last from 1 to 2 weeks. Meanwhile, the common cold is confined to the upper respiratory tract, so the most prominent symptoms are runny nose and frequent sneezing. Other common symptoms include sore throat and some body pains. Dry cough may be present, but it is usually mild. Sometimes, patients may also experience fatigue and rarely fever and headaches. What is not expected is diarrhea. Symptoms last for less than 2 weeks. In patients with allergies, prominent symptoms are runny nose and frequent sneezing. Other common symptoms are shortness of breath, particularly if the patient has an exacerbation or if the allergies are uncontrolled. Sometimes they may have dry cough, fever, or a general feeling of being unwell, such as headache and fatigue. What is not expected is sore throat, body pains, and diarrhea. Other symptoms include itchy eyes. Symptoms may last several weeks if not controlled. Now, what do we do if any symptoms are present? For example, if you have any fever, cough, shortness of breath, or diarrhea, plus travel or residence from or in a country with local transmission of COVID-19, or a close contact with a known COVID-19 case, for example, if you are a caregiver of someone, or staying in a close environment with that positive case, for example, being in the same school or workplace, or being in close proximity, around 1 meter away, plus the symptoms appear within 14 days from the exposure. It is important to coordinate with an ER team for possible admission to a designated COVID-19 isolation area, or, however, if you have mild symptoms with no comorbid conditions, home management of the symptoms may be done. In these cases, you are considered a patient under investigation or PUI. If you have any fever, cough, shortness of breath, or diarrhea, but no history of travel or no close contact with a known COVID-19 case, but you have symptoms of a severe acute respiratory infection or severe pneumonia, or if you have a cluster of flu-like cases in your household or workplace, you still have to coordinate with an ER team for possible admission to a designated COVID-19 isolation area or to be managed at home. In such case, you are also a patient under investigation or PUI. If you have any fever, cough, shortness of breath, or diarrhea, but you have no travel history, no close contact with a known COVID-19 case, or no symptoms of severe acute respiratory tract infection, you're least likely to be a suspect case. That way, you should see a specialist or an outpatient clinic for further management. If you have none of those symptoms, however, you have a history of travel or residence from or in a country with a transmission of COVID-19, or a close contact with a known COVID-19 case, you are advised home quarantine for about 2 weeks, and you are advised to do social distancing. In this case, you are considered a patient under monitoring or PUM. Now, here are a few safety precautions. First, you have to make sure that you clean your hands with soap and water for at least 20 seconds or with an alcohol-based hand rub frequently. Remember that SARS-CoV-2 is an enveloped virus with a protective fat layer, and soap and disinfectants tear apart that fat layer, making the virus unstable or wimpy. Also, disinfect high-touch surfaces, for example, doorknobs, tabletops, chairs, with common household disinfectants such as diluted bleach solution. Cover your nose and mouth when coughing and sneezing with a tissue or a flexed elbow. Throw tissue into a closed bin immediately after use. Avoid touching your face, including the eyes, nose, and the mouth. Avoid close contact with anyone with colds or flu-like symptoms. You must also avoid gathering in crowded places and limiting social gatherings. The CDC recommends keeping 6 to 10 feet away from other people. Strict social distancing, which means strictly staying at home and avoiding unnecessary activities in public places, is recommended. This is to prevent asymptomatic transmission, especially to more vulnerable members of society such as the elderly, immunocompromised people, and pregnant women. In preparing food, you must thoroughly cook meat and eggs. Avoid unprotected contact with live, wild, or farm animals. Wear protective gowns, gloves, and facial protection while handling animals and animal products. After work, remove your clothes and bathe upon arrival at home. Avoid exposing family members to soiled work clothing and shoes. Now, when you wear a mask, number 1, if you are coughing or sneezing, or if you have any of those respiratory symptoms mentioned previously. Number 2, if you're a healthy individual, there is no need to wear a mask when going out. However, if you are taking care of a person with suspected COVID-19, you must wear a mask. It is important to note that masks are only effective when combined with frequent hand cleaning with soap and water or alcohol-based hand rub. Make sure you use it and dispose of it properly. In summary, the SARS-CoV-2 virus is transmitted through droplets and close contact. Therefore, hand washing and social distancing are most appropriate ways to avoid its spread. Overlapping symptoms may be found with seasonal flu, common cold, and allergies. It is important to be able to distinguish COVID-19 from these conditions. Patients with shortness of breath, dry cough, fever, with or without diarrhea are advised to see a doctor immediately, especially if they have recent travel to or residence in a place with local transmission of COVID-19, with close contact with a confirmed case, if symptoms of severe or atypical respiratory infection, or if with a cluster of flu-like symptoms in the household. Proper hand washing is an effective means of killing the virus and limiting its spread. Social distancing greatly helps limit the spread of the virus by preventing direct and asymptomatic transmission. Less people getting sick means healthcare workers are able to pay better attention to more serious cases. So, please stay home and limit movement if you could. I hope that you learned something from today's discussion by Dr. Skin. Let us fight uncertainty by gathering adequate information. Staying home means saving lives. Let us combat this pandemic by doing our part in protecting ourselves and others. Together, let's flatten the curve. Stay safe and healthy!